probably some thyroid enlargement or thyroid problem. I want you to find out also the level of the hormones, no? Ano ang normal level? Numerical value ng thyroid hormone. Slide 170. What is this? Oh, this is another disease affecting your thyroid gland. As you can see, there are variably sized thyroid follicles, and it is grouped in several lobules, and it's divided into several lobules by this fibrous septate. And you can see here that there is some degree of hyperplasia within these thyroid follicles. In fact, may papillary projections ka na dyan. Yan tinatawag mo na papillary hyperplasia of the thyroid follicle. Now, it is also evident here that there are spaces, clear spaces within the thyroid follicles. And what's the cause of this? It is said to be an autoimmune antibody directed against a receptor used by your TSH. So in a sense, it activates that receptor so that your thyrocytes become activated themselves. So yun, nagiging activated sila, they proliferate. May hyperplasia ka dyan, no? And they also produce much of your thyroid hormone. Kaya ang pasyente natin dito, hyperthyroid. Graves' disease, di ba? Sometimes it manifests clinically as yes, exophthalmos because of the accumulation of subcutaneous tissue retroorbitally. No? It's because of the effect of your thyroid hormones. Because there is much. Medyo elevated talaga ang thyroid hormone nila. Which hormone? No. T3 and T4. No? T3 is the triiodothyronine. T4 is tetraiodothyronine or thyroxine. Yun ang thyroid hormones mo. Di ba? Ang TSH ang nag-stimulate nito. In fact, there's evidence that these cells are producing much of the thyroid hormone. Watch. Look at this. This is a complete colloid right there. The colloid is actually the backbone of that thyroid hormone. Which substance is that? Thyroglobulin. That's right. Thyroglobulin will be iodinated. Depending kung ilang residues, 3 sa triiodo, 4 sa thyroxine. But the more active one is your triiodo or the T3. Okay, look at that. May space. That means the cells in here had sucked it up to produce much of the thyroid hormone. This is what we call scalloping. Scalloping. Yeah. They have used up that thyroglobulin right there. So that's your thyroid colloid. Okay, read more about that. No? Your Graves' disease, the clinical manifestation, and the pathophysiology. So which type? Type 2, because antibodies. No? Antibodies are main pathogenesis. 154. Acute interstitial allergic nephritis. Membranous day. 154. Okay. It seems that the thing that we have to take notice here is your glomeruli. So glomeruli here supposedly have thickened base membrane like this, like that. And some, it may be replaced totally by that mass. Ito wala ng mga capillary tufts. basically a hyaline mass right there. Ito may thicken, no? Thickening. So that is membranous glomerulonephritis. This is due to accumulation of what? Accumulation of the membrane right there is due to accumulation of immune complex. That's right, antigen antibody complexes. When you say immune complex, it has an antibody, but that antibody is bound to a soluble antigen, and they float around in your blood. Now that is what we call type 3. Type 3. No? So these antigen antibody complexes float in around your blood vessels and become deposited somewhere, especially here in the glomerulus, because your glomerulus, as you know, is a filter of your plasma, right? Am I right?
Yes.
Oh, kaya dyan mag-accumulate most likely itong mga antigen antibody complexes. And when they do accumulate or become deposited in some tissues, they will initiate inflammatory response in that tissue. Yeah? So, ganyan nangyari. I want you to find out the clinical manifestation associated with this membrane formation. Ano ba yung mga manifestation dyan? Is the glomerular function affected or not? How is it affected? Ganun ang pag-asa sa sarili. Slide 141. What is this? Huh? Ah. Type 3 yun, ha? Yung ano, membranous glomerulonephritis. In this TB, as you can see, it has granuloma formation. This is one granuloma right here. It has a color of lymphocytic infiltrate right there. Fibrosis. And there is the core of caseous necrosis. That is caseous necrosis right there. Sometimes you will appreciate along the borders these giant cells. No? Yes, Langhans type giant cells. I think this one is part of that. You see the PI? Another one here. So usually they're in that vicinity. So this is due to activation of your T helper cells or T cells, which can result to your granuloma formation. The T helper cells can often give off cytokines that also recruit and activate certain cellular components of the inflammatory response. That's why this type of reaction is regarded as type 4 or delayed or cellular mediated cellular response, hypersensitivity reaction. Essentially, you are allergic to TB. There are some of the components of your TB that can activate your lymphocytes so that your body tends to form granulomas. So only those lymphocytes can do that. So, yeah. Lung is affected. Type 4. Cell mediated. Type 4. 137.
Asthma.
Asthma. Look at this. This is a bronchus. So asthma actually affects the airways, and it is said to be an allergic reaction initially. But then it has what we call periods of remission, periods of exacerbation. Sino asthmatic dito? Okay? So you have to better understand that this disease, the more exacerbations you have, the more changes occur. And this is said to be a progressive disease. What are the changes? One, I can see inflammatory infiltrates in the submucosa. So this is your mucosa, submucosa, muscularis. And this is your submucosal glands. And this is the cartilage. That's why I classify it as a bronchus. And look at the lumen. There is mucus plug right there. And as such, it obstructs the opening, the lumen. Now, there is what we call an inflammatory reaction that goes on in here, and the cells that are predominantly infiltrating this wall is what? Oh, medyo orange sila, no? Ganyan, no? Bilobe. Usually that's an eosinophil. This is what type of reaction? Immediate, no? Characterized by reaction to your antibody class E or IgE. So, yeah. There is also associated hyperplasia of this smooth muscle because of the secretion of various cytokines and mediators that can lead to bronchoconstriction and hyperplasia of the tissue right here. So hyperplasia of the muscles, hyperplasia of the submucous or mucosal glands, mucus glands. Now, there is what we call an index associated with how severe the disease is. That's what we call your right index. Now, I want you to read about the right index. It has something to do with the thickness of the wall. Now, the thicker the wall, the higher your index. Therefore, the more severe your disease is. Huh? So sometimes this mucus will partially obstruct so that inflow is not a problem, but outflow is. And that's the main characteristic of asthma, clinically. Are you familiar with the term expiratory volume? Your spirometric findings? Huh? Do you know what that is? Spirometry? And what is the physical finding? Constant in these patients. Madayag. Yeah, by spirometry. But physical finding ba? Kanang imuhang appreciate sa pasyente. You don't have to think about it that hard. O, ikaw, sa may asthmatic, so yung mukhang may experience na ba? Oh, yun. Wheezing. It's pretty common. Now, Neil, naghuna-una na, Neil. Nakinahanglan na siya, Neil. Dapat master na mo na, Neil. That wheezing is due to obstruction in the tiny airways by your mucus secretion. Okay? That's the basic finding that you have there. In larger airways, it can manifest as ronchi. You know what a ronchi is? Ronchus? Huh? Neil? Oh, nakadong lumana. Dito sa simulation ay Simba. Ano po magipadong ka na? Ronchi, wheezing, crackles, everything else. So type 1. Ask 117.
Fibrinoid necrosis of vascular wall.
This is an example of how your antigen antibody complexes can damage tissue. In this case, it is the wall of your blood vessel, probably a large blood vessel. You can see these deposits. This is necrosis, fibrinoid necrosis. You can see that it incites inflammatory reaction beneath in the wall. So if this is your tunica intima, yeah, tunica media and tunica adventitia. Tunica media is infiltrated by varying degree of chronic inflammatory infiltrate. Like so. You don't usually see that in a blood vessel. So in a sense, you have what we call vasculitis with fibrinoid necrosis. Usually there is a fibrin like that. That inflammatory reaction is due to accumulation of antigen antibody complexes. Slide 109.
Ulcerative colitis.
Ulcerative colitis. One basic identifying feature is the presence of your dilated, massively so, blood vessels, massive hemorrhage, and chronic inflammatory response. But this part seems to be spared. So it's up only to your mucosa and submucosa. Your muscularis and serosa seems to be a bit uninvolved. No? So it also is associated with erosion, ulcerations, broad ulcerations, like so. So when you look at the mucosa of this segment, it looks red, no? Erythematous, because of this. That's your ulcerative colitis. That's one thing that you have to do. And it is a component of your IBD, or inflammatory bowel disease. Now, inflammatory bowel disease can also manifest as this. Crohn's disease. Now, Crohn's disease is quite different morphologically from your ulcerative colitis. Why so? In Crohn's disease, you will have accumulations right there, aggregations of lymphoid tissue, along with probably giant cells around it. Yan, mga giant cells. This is a granuloma right here. Another one right here. In fact, it occurs in all the layers. Of the wall, involved wall. Now, what do you notice? In ulcerative colitis, everything is involved, right? But here, there are areas that are normal, like this area. No, normal siya. But may mga area ka na, yan, That's the involved area right there. There's also ulceration. No? Transmural inflammatory response. Granuloma formation. Those are the basic features of your histology associated with Crohn's disease. So there. An IBD. Now, in IBDs, what is the main manifestation? Oh dear. Slide 71. Acute interstitial allergic nephritis. Supposedly you're gonna see here eosinophils in the interstitium. Pero medyo pangit siya ba eh? Laki ko ma-appreciate. The interstitium is the one involved here. China. Slide China. But there is thickening of the interstitium supposedly, and it is infiltrated by your eosinophils. That's one marker here. Sige, memorize na lang ninyo ni Bay. Madala na yung money. Maski yung saan explain niyo, wala gitay. I think some inflammatory infiltrate is there. Let me see if we can appreciate that. Sorry guys. Basta acute allergic na siya. Sorry. Not good. Slide 63. Oh, another skin disease associated with a hypersensitivity reaction, but this time it doesn't form bullae. It forms plaques. But the changes actually occur beneath in the papillary dermis and in the reticular dermis. In the reticular dermis, you're going to see inflammatory reactions perivascular. No? And because of that, there will be associated atrophy of your epidermis. There is lengthening of this papillary dermis. Okay? Dermal papillae, that's what we call, and these are your rete pegs. The thing with this thing is that sometimes the dermal papillae go through up to this. It's so shallow. Actually, your dermal papillae carry much of the blood vessels that supply your epidermis. No? So that when you remove this plaque, sometimes it opens up the dermal papillae, and you will see the blood vessels being opened up as well. So you will see bleeding in there. That is a clinical sign associated with psoriasis. What is that? Kaangganin mo ang scab or kaangganin mo ang plaque, no? Magtugo because of that. What is that sign? Monroe sign? Interesting question, huh? I leave it up to you, man. Slide 29. I think this is good posture. So in good posture, it affects your one tissue here, lungs, but it also can affect any tissue as long as it has a basement membrane. Because here the explanation seems to be what? say psoriasis is a type 4 because of the cellular component. Sometimes you will see abscesses in there, intraepithelial abscesses. So that's a cellular component. Here, the explanation seems to be autoantibodies against your basement membrane. It also occurs in the kidneys. In the lungs, remember your blood-air barrier? Yeah? The first layer is your surfactant followed by alveolar cells. These alveolar cells rest upon a basement membrane. It's going to be followed again by a basement membrane of your endothelial cells. No? So, in a sense, you have a double dose of basement membranes in there. As such, they will receive a double dose of the autoantibodies as well. And this happens when it happens. So you will see foci of hemorrhage, inflammatory response. You see the interstitium thickened. These alveoli are no longer that functional. So, yeah, focal hemorrhages. That's what you see in your lungs. Sometimes it can involve everything there. And in that case, your patient may manifest with massive vomiting of blood. What is that? Hemoptysis. That's right. That's the clinical manifestation here. Hemoptysis. So good posture, no? Pag ganyan, good posture yan. Type autoantibodies na siya. Type. That's it. You study.
Thank you.